Hi, my name is Jacob Hom. I'm a clinical psychologist and director of the Center for Child Trauma and Resilience at the Icahn School of Medicine at Mount Sinai. And today I've been asked to talk in honor of Children's Mental Health Month, May. And I guess some of the big questions that I've been hearing a lot is it's really hard to find treatment for kids right now. Everyone's packed, and the need for mental health is so high right now for children and adolescents, especially during the pandemic. And while people are waiting to get into services and looking for treatment, which I highly recommend for people, and even come to Mount Sinai for such treatment, the question is, what can parents do in the meantime? And like, what do they do for kids? How do they talk about issues? How do they manage anxieties? And I want to start answering that question by noting that how and why questions like that, I'd want parents to slow down and check in with where they are with their own anxiety, because what we've learned about the way that stress and trauma and anxiety works is that the more stressed out we are, especially if we have trauma in our histories, the more likely we are to assume that we don't know the answers ourselves, and that there has to be a clear-cut answer for it. And we need a solution for our problems. And so before answering that question, I'd want parents to just slow down and ask themselves, are you in a survival state of mind right now? Are you like really stressed out and really afraid for your child? And is that level of fear taking over your brain so that you don't feel confident that you know anything about your own child, or feel helpless and hopeless in the face of the stress that you and your child might be under? Along with that, I often say that the opposite of trauma is actually presence. And what that kind of means in like non-cheesy terms, if I can help myself, is that the most important thing I think that parents can do for their children and their adolescents is to really be fully present with them. And how I would define that is like, are you centered? Are you calm? Are you feeling open-hearted and connected to them? Are you really listening deeply to what they're trying to communicate? And oftentimes what they're trying to communicate isn't what they're saying. It's an emotion that they're trying to express while not really wanting to share what that emotion is, or it's an intention about what they want from you, either in terms of like, I need you to validate me, I need you to acknowledge me, I need you to come closer to me in some way, or I need you to give me space in some way. And so I'd ask people to really stop listening to words so much, get centered into your heart, and then listen for what your child is trying to communicate deep inside of them. And from there, you can decide really what they need. And I bet you already know exactly what they might need. You've been with them and gazing into their eyes and understanding what their needs are since the day they were born. And it doesn't change much. The baby that you raised and fell in love with it's still in your child's body. And so even as you're seeing your child or your teenager and they're grumpy or irritable or panicked, you can also see the beautiful baby that they were, and know that their body remembers that your body can comfort them, and have that kind of energy as you talk to them. Along with presence, the other important part of really attuning to your child and seeing really what they need from you is learning to communicate from that place. And in my field, we call that meta communication, which means that you talk about what's happening between the two of you, or you talk about what you think you see. This is where you're using language to really like call up or understand what the emotions are and what the intentions are behind the communication. And so I really encourage parents to both communicate from a place where they're speaking from their emotions or their intentions, and asking questions of their children and adolescents that solicit emotions and intentions, and makes more and more space for experiences to be understood, if that makes any sense. Instead of moving so quickly to coming up with an answer, ask questions that help you understand the context of why these questions are coming up, why your child feels a certain way. And don't be satisfied until you can really walk in their shoes and conclude, now I fully understand why you feel this way and why you must want to do whatever it is that you want to do. Like, like in the worst case scenario, why you'd want to like quit school or like have no more friends or whatever outrageous things that kids might be feeling that can be really scary for us, or even wanting to hurt yourself. Instead of really being scared by that immediately, well, you should definitely be concerned about it. But I think that it's so important for us all to get into their shoes of like, why is it so bad right now? Help me understand that. And in that understanding and in that act of trying to understand, children and adolescents will feel held and understood. And sometimes that's the most important medicine that they can receive from another person, or the most nurturing and nutritious thing that they can get from another person. And then after all of that is done, then you can go into problem solving and actions and solutions. I swear that so much of what it means to become a good therapist is actually learning to do nothing, to do more of nothing, to not act so quickly, to learn how to sit on your hands as you're listening to painful things and bearing witness to what you're hearing, and really making sure that the other person understands that you hear what they're saying and you can feel what they're feeling, and then possibly offering and or asking them if they themselves want further help than just that. Yeah. So to conclude, I know that people are really panicking and confused and want answers to questions. And before you go there, before you really look for solutions, I'd really encourage you to settle back into your body and make sure that you understand whether or not you're acting from survival and fear, or whether you're acting from a place of clarity and calm and connection with your child and adolescent. And then keep slowing down and asking more and more questions to open up space. And then if all of that's done, then collaborate with your child and adolescent to come up with solutions that work for them. And then keep learning from that and adjusting what you discover. I hope that's helpful. I know I gave you no answer, but I'm hoping to give you pause at least. Until I see you again, thanks for tuning in. I'll see you later.